Doctors Beggs and Parsons discuss the current status of gene therapies in rare neuromuscular disorders in this 8-part podcast series. This is derived from the symposium that was presented at the MDA 2025 conference in Dallas, Texas in March 2025 and is intended for healthcare professionals only. This podcast includes information about investigational compounds that do not yet have a regulatory approval or authorization for a specific indication. The safety and efficacy of the agents under investigation have not been established, and contents of this podcast shall not be used in any manner to directly or indirectly promote or sell the product for unapproved uses. The Aspiro clinical trial is on clinical hold since September 2021.
The views, thoughts, and opinions expressed in this presentation belong solely to the author and are subject to change without notice. The contents of this presentation do not constitute an endorsement of any product or indication by Astellas.
In this part, Dr. Parsons will discuss clinical safety and efficacy observed in AAV-mediated gene therapy programs in DMD, SMA, and XLMTM.
So as we talk about the gene transfer therapies and the modalities that we have to use, it's really interesting. Yesterday with our keynote speaker, you could see this sort of logarithmic growth of the use of gene transfer therapies for these disorders. And if you look at the Venn diagram, you can see that really 27% almost of gene transfer therapies that are used are in musculoskeletal and neurology, and for many of us as neurologists, we also take care of metabolic disorders. So we really own right now this landscape. And of course, our two approved modalities are Onasemnogene and Delandistrogene. So we're going to sort of look at 3 different disorders, monogenic diseases, to sort of typify what we look at in terms of some of the risks and benefits of these treatments. So SMA, Duchenne, and X-linked myotubular myopathy are all rare disorders. They're all diseases that have a high unmet medical need and a significant disease burden. So I think they're all good in terms of typifying where we are clinically with these disorders. So the first question is it worth it? So are these effective treatments? And we know from looking at the information about SMA that just looking early on, we know that if we treat kids early, that we do see a marked improvement in motor scores for kids that are treated early with onasemnogene. In Duchenne, we have information that there is at least some improvement in the 4 to 5-year-olds in terms of motor skills treated with delandistrogene. In terms of X-linked MTM, which was a very dramatic kind of improvement, you could see that for boys who were basically trached vented and had no mobility, the bottom line, the blue line, is actually looking at ventilator dependence. So are they effective? Yeah, they're effective. But then we have to say, okay, what's the downside? And the downside is that there's tremendous risk associated with treatment with these agents. And if we really look at the sobering facts, we know that with SMA there have been deaths, there have been fatalities related to thrombotic microangiopathy, to patients who have liver failure. A couple of patients have died. And with onasemnogene, this is 4,000 plus doses that have so far been given. With Duchenne, unfortunately, many of us got the letter yesterday talking about an additional death in a patient treated with commercial delandistrogene. But we also know with some of the other agents like fortadistrogene, patient died of heart failure, cardiac arrest, another patient who had acute respiratory syndrome with pulmonary edema. So again, we look at this and say, this is significant. With X-linked MTM, as Alan said, there were some unanticipated deaths, 4 deaths from patients who ended up having cholestatic liver disease that really wasn't anticipated prior to the patients being treated with the animal models and all that we had. And then many of you have heard about the patient with Rett syndrome who had a systemic hyperinflammatory syndrome. So again, these are rare disorders. They have a high disease burden, but the risk of treatment is significant.
In the next part, Dr. Parsons will discuss factors impacting safety and efficacy of AAV-mediated gene therapies.